I have provided privacy for my patient. Hi, my name is Zhiqing. I'm a nursing student from Auckland University. Today we'll be doing an assessment of your neurological system and musculoskeletal system. This assessment is going to take about 15 minutes. Before I start, I'm going to wash my hand. So, can you tell me what's your name?
My name is Sanjay Cannon.
So, can you tell me what day is today?
Today is April 4th, Sunday.
Okay, so can you tell me where we are?
We are in Northwell, Michigan.
Can you tell me what we're doing right now?
We are doing an assessment.
So he answered 4 out of 4 questions correct. His level of consciousness is alert and aware times 4. So Mr. J, have you had any history of trauma?
No.
Have you noticed any joint pain, muscle pain, weakness, numbness, or tingling?
No.
Okay, so we moving on to the neurological system, starting with the cranial nerve number 3, which is oculomotor nerve, and cranial nerve number 4, which is trochlea nerve, cranial nerve number 6, which is abducens nerve. I'm going to start with the pen line to see his pupil size. So it's about 4, it's rounded, and it's equal on both sides. Next, I'm going to use the pen light to check his reactivity, starting with the direct response and indirect response. Now switch to the other side, direct response, indirect response. So he's reactive to the light. Next, I'm going to do the cardinal position of gaze. Just follow my fingertips, but don't move your head, okay? Now I'm check the accommodation. Good. So his pupil shape is round and is equal on both sides. He is reactive to the lights with accommodation. So his cranial nerve number 3, 4, and 6 are intact. Next is going to the cranial nerve number 5, which is trigeminal nerve. I'm going to palpate his masseter muscle. So Mr. J, can you open your mouth? Now close. Open again. Clench your teeth. Now you're good. So he was able to open and close his jaws with same strength on both sides. So his cranial nerve number 5 is intact. Now we moving on to cranial nerve number 7, facial nerve. Can you smile?
Yes.
Just do it. Smile.
Oh, smile.
Yeah. And then raise your eyebrows. And then do the pop out your cheeks. Good. So he was able to do all these things. So his cranial nerve number 7 is also intact. Next is going to be the cranial nerve number 11, which is spinal accessory nerve. Can you shrug your shoulder? So he was able to do this. His cranial nerve number 11 is intact. Next is going to be the cranial nerve number 12, which is hypoglossal nerve. Can you stick out your tongue? So his tongue is midline to his body without any deviation. So his cranial nerve number 12 is also intact. Next, we're moving on to the cerebellar function. Can you put your hands on your side and flip very quick? So he was able to do this. So his cerebellar function is also intact. Next, we moving on to musculoskeletal system. Starting with the shoulder. Can you take off your shirt? Starting with the inspection, I see symmetrical on both sides. They're on some level. Next, I'm going to palpate for the temperature. Also, I'm going to feel tenderness. Just tell me if you feel any pain.
Okay.
Did you feel pain?
No.
So he didn't report any tenderness and he's warm to touch. Next, we're going to do the range of motion. You can stand up and just follow me. That's flexion, extension, abduction, adduction. Now do like that. External rotation. Now the back. So he has full range of motion on his shoulder. Next, we moving on to the elbow. You can sit down. For the elbows, starting with the inspection, so the color is consistent to the rest of his body, and I didn't notice any swelling. Next, I'm doing the palpation. Just let me know if you feel any pain. Do you feel any pain? So he didn't report any tenderness. And then we do the range of motion, starting with the flexion, and then extension, pronation, supination. Good. So he has full range of motion on his elbows. And then we test his muscle strength. Do this again. I'm going to push you just against me. Then pull. So his muscle strength is 5 on his elbows. Next, we're moving on to his right wrist and hands, starting with the inspection. The skin color is consistent with the rest of his body. I didn't notice any swelling. And now I'm going to palpate. So, do you feel any pain?
No.
So he didn't report any tenderness. Next, we move on to the range of motion. Just follow me again. That's the wrist flexion, extension, finger flexion, finger extension, and then finger abduction. Good. So he has full range of motion on his wrist and hand. Next, we're going to test his grip. Just hold my hand. Okay, so his strength is 5 on his grip, and then we moving on to the capillary refill. Just give me your hands. Like that. Doing both at the same time. So the capillary refill, going back to under 3 seconds, which is normal, and then we going to check his radial pulse right here. And then the other side. Good. So his radial pulse is 2+ strengths with steady rhythm on both sides. And then do the brachial pulse. And the other side. Good. So his brachial pulse is also 2+ strengths with steady rhythm on both sides. Next, we moving on to the lower extremity. Can you lie down, please? So, starting with the inspection of his iliac crest and knees and ankle, I didn't notice any swelling. Okay, put your legs together. So his leg is aligned. Next, I'm going to palpate his hips. And then knees, and then ankles. Do you feel any pain?
No.
So he didn't report any tenderness. Next, I'm going to palpate for the edema on his pretibia area. I'm just going to push down and let it go. There is 0 pitting present, which means there's no edema on his pretibia area. Next, I'm going to do the capillary refill. So I'm going to do the both sides. The capillary refill is under 3 seconds on both sides, which is normal. And next, I'm going to check his dorsal pedis pulse. Is right here. And then the other side. So his dorsal pedis pulse are 2+ strengths with steady rhythm. Next, I'm going to check his posterior tibia pulse. It's going to be right here. And then the other side. So his posterior tibia pulse is also 2+ strengths with steady rhythm. Can you now I'm going to the range of motion test. Can you bring your knees to your chest? That's flexion. Now put it back, extension to the other side, flexion, extension. Now I want you to move your legs outwards. That's abduction. Now inwards, adduction, the other side, abduction. Now go back, adduction. So he has full range of motion on his hips, Now can you moving back to sitting position? So I'm going to test his muscle strength of hips. Just try to push against me. Okay, so his hips strength is 5. And now I'm going to test his knees muscle strength. Try to against me. Then pull. So this muscle strength is 5 on his knees. Next, we go into the ankles. Now, just follow me. Do the plantar flexion and then dorsal flexion on both feet. Yeah. And then do the eversion. Yeah. And then inversion. It's going to be, yeah. Okay, so he has full range of motion on his ankles. Next, I'm going to test his muscle strength on his ankles. Now, can you put your feet on my hand? Now, then press down. Okay, then against me. Good. So he has strength of 5 on his ankles. Next, can you stand up? Now we moving on to the spine. His spine is symmetrical on both sides. Starting look at his cervical spine is concave, and thoracic spine is convex, and the lumbar spine is concave, and then sacral spine is convex. Next, I'm going to palpate his spinous process. Just let me know if you feel any pain. I'm going all the way down to the sacral spine. Do you feel any pain?
No.
So he didn't report any tenderness. Now you can face to the camera.
Okay.
Next, we doing the range of motion test. First, we starting with the flexion, bending forward, then extension, backwards, and then rotation. Don't move your hips. Right, and then left, and then lateral bending, left, right. Okay, so he has full range of motion on his spine. Next, we're going to test his gait. Can you show me how you normally walk? To there and then walk back. Yeah. And then show me how you walk like that. Then can you walk on your heels? And last, walk on your toes. Good. So I didn't notice any abnormal movement. So he has steady gait. So we have finished the assessment. I'm going to wash my hands again. So Mr. J, we have finished today's assessment. Thank you for your time. I'll see you next time.
Thank you very much.
Mhm.